Assalamu alaikum. Thank you very much, Professor Shahid Sarwar, uh, for these kind words. I should say, I don't know if I deserve these or not, but you've been, very kind. And our association is not just very recent. We have been associated for the last 22 years or 23 years. And that's sort of, it's not a small tenure where you spend few years and go away. It's a continuous relationship which you develop as a student, as a colleague, and now as a very well established mentor and professor who is contributing to the society. I think, few things which I would like to pass on to my junior colleagues uh, that, whenever you come to an institute, you should have a goal that what are you going to achieve? And that goal can be a short-term goal or long-term goal. Short-term goal for you would be that you want to pass your FCPS exam, which is the most important goal for you. Without that certificate in your hand, there is no value, at least in this country. So that should be your first priority, that you have to pass that exam. Sounding. But during that 2 or 3 years of your journey, while you are proceeding towards this goal, you must inculcate some good habits. And these good habits can be dealing with your patients, dealing with your colleagues, dealing with your juniors, dealing with your seniors. And these come with time. Not all of us have the same background of our home environment, our school teaching, but we can always learn, we can always change for the better. So this should be, there is no such thing that, your diet cast that you cannot change. So every stage you are evolving, every stage one is learning. And I tell you that I'm just coming from a workshop from Florida, where it was a live workshop just like this, and people uh, from America, from other places, South America, they were there. They're known all over the world. But for me to go there is a zest for learning. Otherwise, you reach to a standard where you say that, okay, I've done enough, I've achieved enough, so, you know, I should just stop here. But this should be a lifetime goal of learning. And unless you have this zest of continuing to learn, the you know there is no chance that you will go with the cutting edge of what is happening in the technology or in the knowledge. So this is one thing. The other thing is that some of my teachers who were very close to me, and I really revere their teachings all my life. And some of them were Professor Zafar Haider. I don't know if any of you have met him or seen him. He was a legend. Hayaz Zafar, he was a legend. So they taught us during the medical college some of the very important aspects. That when you're seeing a patient in a ward or in a bed, just consider yourself that it could be your brother or sister in the bed, and how you would treat them, how you would deal with them. And your feeling should be a compassionate feeling. It should be a feeling of taking care of them just like you're taking care of your relative. So that kind of stuck with me, that it is not that you consider them one 21 bed number patient, 22 number bed patient. No, they have a name, they have a family, they have a personality. Now they're at your behest that you have to take care of them. So that should be the way you treat them, the way you question them, the way you do a privacy for them, because you would do a privacy for your sister who is in the bed. So why not somebody who is in front of you there? So these are some of the things you have to really be very, very careful about. The other thing is about what is happening in the arena of knowledge, arena of getting at the cutting edge of your knowledge, is that you're very lucky in this time and age. That I remember when I was a fellow, I used to travel 5, 10 miles, sometimes 50 miles to go to a huge big library, which used to be NIH library or Georgetown library, where I would sit for hours, sift through different journals, sift through different books of the topics or publication which I had to do. But you all have now at the tip of your fingers. You can access that with your mobile phone. You can access it with your laptop. So you don't have to make all that effort, and it's all available to you. And now when I go to give a lecture or some discourse, and my students or my fellows, they have already read which I have just read this morning. So they're as knowledgeable as I am today. The only difference is that I can tell them that what is important out of this and what is frivolous out of this. So that is the only difference. Otherwise, the knowledge availability is all the same. So take advantage of it and never lose sight of what's going on in the current affairs. With this, I don't want to take too much time because workshop is where you actually do things and the patients are there. The advantage of the live workshop is that the operator is put to a test as much as all the viewers are, okay? Because I can run into complications, which I run in a daily life, and how I deal with those complications. These are the differences. A routine run-of-the-mill case, you do a colonoscopy, endoscopy, with your closed eyes. But when you run into complications, how you deal with it, that is where the differences lie. So feel free to ask questions. Some things which I might consider that you already know, I take it for granted, but for you it may be new, so don't be shy about asking those. Even no question is a frivolous question. Okay? Just ask whatever is in your mind, and this is the time and the opportunity for you to really learn something. Thank you very much.
We would also like to welcome Professor Akif Dilshad, who's also here with us. And now to begin with our first case, I would request Dr. Imtiaz and Dr. Yasir to please guide Dr. Professor Anwar Khan towards the endoscopy suite. For the first case, our presenter, Dr. Ahmed, PGR Gastroenterology, will give a brief history of this case.